I am Dr. Michael Jungman, a specialist anaesthetist from Sydney, Australia, and I would like to tell you about the Vasca mask. The Vasca mask is a newly invented third-generation supraglottic airway device. Firstly, I will briefly outline the features of the device and later demonstrate its insertion and functions. The device offers some unique features which make the Vasca mask the only third-generation supraglottic airway device. Firstly, the membranous design of its ventral surface enables a high seal pressure as airway pressure increases during the inspiratory phase of intermittent positive pressure ventilation, whilst during expiration, any pressure the device exerts on the surrounding tissues is reduced. An important feature of this device is that the maximum pressure exerted on the surrounding tissues never exceeds peak airway pressure. Also, notice that there is no inflatable cuff, thereby eliminating the risks associated with cuff under or over inflation. Secondly, the dorsally located sump cavity, which does not communicate with the airway cavity, together with its suction and vent channel, enables clearance of regurgitated or other pharyngeal contents. Suction is applied to the proximally located suction port. This suction may be applied either intermittently or continuously. This feature is unique to the Vasca mask. Furthermore, there is no need to insert a gastric tube, as a correctly positioned Vasca mask does not cause stomach inflation during intermittent positive pressure ventilation. Thirdly, negotiating the palatopharyngeal curve by existing supraglottic airway devices can at times be difficult, especially when the head and neck are in a neutral position. The Vasca mask can be angulated to negotiate the palatopharyngeal curve if required by traction on a tab to increase the angle of the device. In this segment, I will demonstrate the insertion of the Vasca mask. It is crucial that all the steps are followed to increase the likelihood of successful mask placement. Acquiring the skill to correctly position a Vasca mask does require practice and some perseverance, especially when you are first becoming familiar with the device. Step number 1. Generously lubricate the distal half of the mask portion of the device with a water-soluble lubricant. The ventral and dorsal surfaces, as well as the tip, require lubrication. Step number 2. Ensure adequate depth of anesthesia. The use of a muscle relaxant significantly facilitates mask placement and is highly recommended to practitioners new to the use of the device. In cases of shorter duration, a muscle relaxant dose, which is only a fraction of the intubating dose, is suitable. Step number 3. The patient's head and neck are placed in a neutral or slightly extended position. If required, an assistant may facilitate mouth opening. Step number 4. Compress the proximal portion of the cuff and body of the mask between the thumb and index and middle fingers of your dominant hand. Step number 5. Advance the device towards the hard palate, avoiding the tongue. It is important to prevent the situation where the tip of the tongue is trapped in the airway opening of the device and the tongue is dragged deeper into the mouth, thereby obstructing further insertion of the device. Step number 6. Whilst holding the stem of the device in position with your dominant hand, gently pull on the tab with your other hand, if needed, to bend the device to negotiate the palatopharyngeal curve. You must release the tab as soon as the tip of the device passes the palatopharyngeal curve to avoid the tip entering the larynx. Step number 7. Ensure the mask is advanced sufficiently until resistance is encountered. In this position, the tip of the mask is engaged into the upper end of the esophagus. Step number 8. Check adequate positioning of the mask by gentle ventilation. Step number 9. Secure the device in position. Step number 10. Suction may be applied to the suction port. The timing of the removal of a Basker mask from the patient's airway following emergence from the anesthetic is similar to that of any other supraglottic airway device. There are, however, two important differences. Firstly, leave the mask secured in position until just prior to removal to prevent premature displacement of the mask. Secondly, apply suction to the suction port as you slowly withdraw the device from the patient's airway.